Hi, I'm Daniel, and I'm going to be showing you how to do the incentive spirometer competency today, or the IS competency. So I would receive an order for a patient to be given the incentive spirometer. So when I get the order, I would go into the computer, I would check the background of the patient, so I would see why they're being given the IS. So it could be maybe they just got out of surgery, or maybe they already have atelectasis that's been confirmed in an x-ray or something. So I would be giving the IS to help reverse or prevent atelectasis, which is collapse of the alveoli. So while I'm in the computer, looking at the background, I could also check for the patient's gender, their age, and their height. And I would be checking for those things because this little slip of paper comes inside the packet with the IS. And when you look at the sheet, it gives you, like right now, my patient is a 5'7" male who is 23 years old. So I rounded up from the 5'7" to 68 inches. And I also rounded up his age, 25, so I got 3,200 milliliters. So I know that my target is 3,200 milliliters. So before I go, I can set that. And I will also probably be marking it with a Sharpie when I get to the room and I confirm his height and age with the patient. So now I would go to the patient's room. Knock, knock, knock.
Come in.
Hello, Mr. Jeanette. My name is Daniel. I'm from Respiratory, and I'm here today to give you an incentive spirometer, okay?
Okay.
All right. So I would sanitize and glove up. Right now I can get my patient identifiers. So can I have your full name and date of birth, please?
Della Jeanette, September 29, 1996.
Okay, thank you. I would confirm that that's my patient. Another thing that I could do is I could also check the bracelet. I'm just going to check your bracelet.
Okay.
And I could confirm patient identifier that way also. So I'm just going to get your vitals right now, okay?
Okay.
I'm just going to take a listen to your lung sounds. Before I do, I'm going to put the pulse oximeter on, and that's going to tell me the heart rate and the oxygen saturations. Okay, so I'm just going to need you to take some deep breaths. And again. And again. Okay, just a couple more. Ox off. So I would write those down so that way I can remember. Now I would also confirm his age and height. So can I have your height, please?
5'7".
You're 5'7" and you are 23, correct?
Correct.
Okay. So today I am giving you your IS. I saw that you got out of surgery a little while ago. So what the IS is for is we want to prevent atelectasis. So what atelectasis is your lungs, gas exchange happens in kind of like it looks like sort of like a grapevine if you would think of it that way. So you have your tubes where all the air is running down, and then at the bottom are the grapes. Those are called alveoli. So think of a nice, plump grape. That would be a nice alveoli. What can happen is you had surgery, so you are in bed. You're not getting up, you're not moving around. You might be taking shallower breaths while you're in bed also. So those grapes can kind of turn into something like a raisin, and that would be a collapsed alveoli. And when they collapse, your oxygenation won't be as good. You might have to work harder at breathing, and your overall discomfort is gonna be a lot, I'm sorry, a lot worse when you get a new glove, okay? So, where was I? So, what we're gonna do is we're gonna give you the IS, and it's gonna help prevent the atelectasis in your lungs. So that way we can keep your alveoli nice and open, and we can keep your oxygenation up, and we can help get you out of bed a lot faster, okay?
Okay.
All right. So you are 3,200 milliliters, that's the target goal on the IS. So one thing I could do is I could mark 3,200 with the Sharpie. I'm not gonna mark it on his, but I would wanna do that because maybe if someone grabs it the wrong way, or while someone's moving it, they move this, and then the patient looks at it and they don't remember that their goal is really 3,200, now they're going to a different spot. So what we could do is we could mark it with the Sharpie, so that way the patient always knows. All right, so what we're gonna do when we do this is you're gonna, just a normal exhale, so just breathe out normally. After that, you're gonna take this and you're gonna make a nice tight seal, and you're gonna take a deep breath in. And when you do that, there's these two arrows right here on the side. This little ball thing in there, if you breathe too fast, it's gonna jump up to the top, and if you don't breathe fast enough, it's not gonna move. So what you wanna do is you wanna keep it in between the two arrows. Okay, so you're gonna, when you do that, you're gonna have a nice breath hold of 3 to 5 seconds at the end, and that's gonna help stretch them out. So it's gonna look something like, you know, just a normal exhalation. Breathe in. And then breathe out after your breath hold. And that's all it is. Okay, do you have any questions?
Is that gonna hurt?
It could possibly hurt. It could possibly hurt the patient if they just had surgery, maybe in their abdomen or something. If they had like a leg surgery or something, it's probably not gonna hurt their stomach too bad. If they did have surgery anywhere around here, one thing that they could do is they could take a pillow and they could hold it against themselves like this, and they can kind of splint for when they're taking that deep breath. So what I'm gonna have you do is, again, just a normal exhalation, and then nice deep breath in. Try and hit your target volume of 3,200 milliliters. Hold your breath for about 3 to 5 seconds, and then go ahead and let it go, okay?
Okay.
Keep going. All right, that's good. That's good. Take a break.
Okay.
Take a break. Know you're still kind of out of it. So go ahead and take your time. When you're ready, go ahead and take another deep breath. Keep going, keep going, keep going, keep going. Good. Good. That's better. All right. And go ahead and take a break. You can get a little lightheaded doing this. You know, all the deep breathing and everything, you could get a little lightheaded. So that's a complication of it, okay?
Okay.
Keep going, keep going. All right, go, 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 go. Oh, that was a good one. Take a break, go ahead. Go ahead, take your time.
So how many times do we do this?
Right now we're just gonna do a few. You just need to do one more,
Okay.
and I'll tell you the rest after you. Looks like you're ready. Keep going. All right, that was good. That was good. So the max looked to be about 2,200, so I would remember that or write it down for charting later. And you asked how many times are we gonna do this? We wanna do it about 5 to 10 times an hour. So if you're reading or something, just every few pages, go ahead and take a couple of breaths. You don't gotta do all 5 to 10 at once, so you can just do a couple. A little while later, do another 2, maybe 3. If you're watching TV, a good way to remember is every time a commercial comes on, go ahead and grab this. Go ahead and do one. You can wait about a minute or something, and then go ahead and do another one. And again, we really wanna do this because we wanna prevent any atelectasis from happening. And that's pretty much it about that. Do you have any questions or anything?
No.
No? All right, I'm just gonna get your vitals one more time.
Okay.
Pulse ox. Get the heart rate and saturations again. And deep breath for me. Deep breath in. All right. All right, almost done. And one more. All right. Okay, and that's gonna be it. Unless I can get you anything. Is there anything you need? Anything I can get you?
No.
No? All right, well, I will come back later to check up on you, okay?
Okay.
All right.
Thank you.
Thank you. So I would glove off, dispose of these. I would wash my hands or sanitize again. I would chart my findings. So what I would be charting is the vitals prior to giving him the incentive spirometer and also the lung sounds. And I would be charting the vitals and the lung sounds after I gave him the incentive spirometer. I would chart any differences, so any improvement in aeration or anything like that. If there were crackles prior, I would be hoping for no crackles afterwards. That would be a good sign that the therapy worked, opening up the alveoli. I would be charting his best volume. So some of the complications for the incentive spirometer would be the lightheadedness, maybe some barotrauma. That's not common at all, though. I think that's pretty much it. That's it. That's the IS competency.